So I really enjoy knocking on doors and getting to know our citizens in the community and hearing about what their concerns are. And I hear about healthcare all the time. And I can tell you that people are very concerned about losing their health coverage when they switch jobs. They're very concerned about family members with pre-existing conditions being discriminated against in our healthcare policy. And they're very scared about the increasing costs of prescription drugs. I am a big supporter of Medicaid expansion. I am interested in supporting and making sure more people have access. I am against the work requirements because I think it sounds like a whole lot of bureaucracy. And that's the last thing that low-income citizens need, is a bunch of extra paperwork and bureaucracy to get access to health care. We need people to be healthy so that they can have productive lives and be in the workforce. I think that the community service boards have been hard hit in the last year. There's some budgeting problems that they've had during Medicaid expansion, and so my #1 priority will be to help shore up the community service boards and make sure that they have adequate funding after Medicaid expansion. I'm also very concerned about funding for mental health. I am sick and tired of hearing about our jails being used as mental health facilities. And we need to support our local sheriff's departments to make sure they have the funding for mental health professionals and that they can do what they need to do to make sure inmates have access to the services they need to keep them from offending and re-entering the criminal justice system. So I think mental health is a really important aspect. And, you know, I'll say, back to drug prices, I've done some research on what other states have done to try to control the skyrocketing costs of prescription drugs. And in Maryland, they recently passed a drug price affordability board. And I have researched the legislation, I have the fiscal impact statement for the legislation, and if you help me get to Richmond, I will be ready to introduce that legislation on day 1 when I'm elected. Thank you so much.
Thank you, Shelly Simonds. You must be reading my notes over here because we have several cards and questions about mental health and gun legislation, so perfect segue into our next question. Mike Mullen. Again, we have several questions about gun legislation, mental health.